What an inspiring way to get our evening rolling. It is now time to meet our keynote speaker, and Glen Garrick has the distinct pleasure of introducing Dr. Melissa Lem, who is going to be our inspiring speaker this evening. Glen is the Sustainability Manager in Facilities Management, Energy and Environmental Sustainability at Vancouver Coastal Health, and he has introductory comments to welcome Dr. Melissa Lem. Please come on up, Glen.
Great, thank you. Very inspiring. Really appreciate your invite. This is an awkward room, but 180 degrees of thank you that I get to be a part of this event. And that I can come and just thank you as a healthcare professional and as a father myself of two small boys, same ages as Melissa or Dr. Lem. Really appreciate all the hard work and all the money you put towards this organization. Speaking of healthcare professionals, did you know, fun fact, that 30,000 healthcare professionals drive to work every day in a single occupancy vehicle? Fun fact, every day they commute to work and home in a car by themselves, 30,000 across the Lower Mainland. This fun fact was brought home to me last week as I talked to a friend of mine who was very, very upset because her second child was just diagnosed with asthma. She was very frustrated. She has two boys like myself, and she was very frustrated at that. Yes, she does actually live close to a large road with lots of traffic. Can we link that? Possibly. Could we link it to the cleaning that she does in her house? The chemicals, the toxic chemicals that come from the cleaning supplies? Possibly. Could we link it to something else? Maybe from a smokestack close to her house? Possibly. But one thing is for sure, as a healthcare professional, we are not living up to our mandate to protect human health because of the negative impact that we are making on the environment. Now, let's be clear, I'm not here to criticize healthcare professionals, as I am a healthcare professional, as Melissa as well. But I'm here to tell you that we recognize this, and we have people in senior leadership, we have people like myself that are working on this. We've been carbon neutral since 2010, not quite 2007, but we've been working on carbon neutrality since 2010. Backing up even a little farther, 2008, I launched an initiative called Green Care within Vancouver Coastal Health, which is now represented at Fraser Health, is now represented at Providence Healthcare, and Provincial Health Services Authority as well. This initiative is all about reducing the negative environmental footprint that we have. It's about trying to get staff out of their single occupancy cars. For human health, bike, walk. For reducing carbon, take transit, carpool, work from home if you're allowed to. As well, it's about reducing the energy that we use. Save some money for patient care. Reduce the amount of carbon that's produced from the energy. Reduce the amount of water that's required. You wouldn't believe how much water is dumped down the drain. The healthcare sector is one of the worst across Canada when it comes to water consumption, when it comes to energy consumption, and when it comes to waste. So what can we do to reduce that? What can we do as an organization, as a healthcare professional, to improve that? Our role is to recognize that, and our role is to listen to the public. When the public comes forward and says, hey, I didn't like that I went to such and such hospital because I didn't see any recycle bins. We need to acknowledge that we're failing the public at that point, and we need to do something about it. We need to hear the criticism, and we need to find the gaps that we have, and we need to start to bridge that gap between human and environmental health. So this program that I launched is about energy conservation, water conservation, it's about waste reduction, it's about active and clean transportation, but it's also about being more resilient around the climate emergency, which you'll hear more about tonight. We strive to be carbon neutral, we strive to reduce our environmental footprint, but above that, we strive to make the connection with every healthcare professional across BC between human and environmental health. That our operations actually don't cause harm. It's a lot of work, and it's difficult. But this is where friends like Melissa, Dr. Lem, come in as kindred spirits, very much kindred spirits. And this is work that she's been spearheading very much too. So let me jump into introducing Melissa. Melissa and I have known each other for a few years, and we've really enjoyed swapping stories and some of the work we do. Melissa is a board member of the Canadian Association of Physicians for the Environment, better known as CAPE. This advocacy group does a lot of work around climate, but they do a lot more work even beyond that. Melissa's, or Dr. Lem, use the informal, sorry.
You can call me Melissa.
Okay. So Melissa's also Director of Parks Prescriptions for BC Parks Foundations. And beyond that, she also does a lot of research advocacy on air quality around forest fires, around climate change, fracking, LNG, and also really trying to make the link between natural and human health. So out of curiosity, just before I came here, I decided to Google her name to see, where she put out some publications, who's talking about Melissa, or talking about the work she's done. And I found stories as I went through it in CBC, the Vancouver Sun, the Toronto Star, the Montreal Gazette, the National Observer, Alternatives Journal, and then I started finding stories down in Seattle, in Tacoma, all attributed to her and her work. It's not just national, but she's actually crossing south of the border too. She's very much recognized for the work she's been doing.